Welcome to Mom Matters, created by moms for moms. We continue the conversation on menopause. I am so excited to bring the specialist in-house here for all of us to learn from. We have Hannah Underdahl. She's a board-certified women's health practitioner. Hannah, menopause.
Yes.
Dun, dun, dun. The big word, right? Like, we could talk about this literally for years, which was funny because you and I were just chatting. You're like, yeah, I actually do that. The conversation is endless. Okay, so we've talked quite a bit on Mom Matters about menopause, signs, symptoms. Basically, we've discovered, it's not one size fits all. There are some very popular common symptoms like what? Hot flashes, what else?
Okay, so the most common things people come in with are actually insomnia, irritability, yes, hot flashes, and mood changes. That could be depression, anxiety, real irritability, or getting really frustrated with your family, your friends, your children.
Yeah, and I'm so glad you pointed out it's not just mood swings, right, like that some of us might be accustomed to with PMS, but it's actual onset of anxiety, sometimes severe, depression, sometimes severe. That mental health aspect can be really a sign that something is shifting and changing. Okay, so women, they know something's up, right? We can tell. Something's just a little off. We go to our GP and we're like, hey, I'm not feeling right. I think I'm going into menopause. What typically happens at that point?
Typically, unfortunately, women are brushed aside. And it's important to know that your GP, your primary care provider, is doing the absolute best job they can with the information they have, but they might not have the information, and that's not their fault, because education on menopause has been left out of medical training for over 20 years. So we're just now getting it back. So what typically happens is, let's say the symptoms are mood swings or irritability, anxiety, depression. The woman is offered a mental health medication. Or if the symptoms are heart palpitations, they get a full cardiac workup.
Yes.
And menopause really isn't addressed. Even if it is diagnosed, you get a pat on the back. You might get a recommendation for a therapist, and that's about it.
Okay, what can we do though to help ourselves? What do we do? Because that is, frankly, it's not enough.
No, it's absolutely not enough. Unfortunately, the burden lies on women then, which means that women will have to advocate for themselves and get second, third, even fifth and seventh opinions. Research shows that women have to see multiple healthcare providers, up to 7, to even get an accurate diagnosis and be offered safe, effective treatment.
Okay, so what are some of these safe, effective treatments that women should know about?
Yeah, so there are hormonal and non-hormonal options to treat the symptoms of menopause. Almost every woman can have hormonal options. That's a misconception. Yes, there are some folks who, safety-wise, do not meet criteria for those therapies, but almost everyone can, and everyone deserves at least an informed discussion on it so that they can make the choice for themselves. That includes therapies with estrogens, progestogens, and even testosterone. Then there are non-hormonal options, which include other medications that help with hot flashes and mood swings and even arthralgias, or achy bones and muscles.
Oh!
I know, right? This treatment and these decisions are so unique because the way you should be approached in a visit is entirely different than the next person that walks through the door.
Yeah, because it's completely different introduction, if you will, into the process of that transition and that shift. Okay, resources.
Yes.
Where do women go to learn more about this?
Okay, I would say it really depends on how you learn best.
Okay.
Do you need an in-person visit to learn? Do you like podcasts? Do you prefer to bring books? I brought my top 4 books today, and these are books that both providers and patients can read. These are my personal copies, so they look a little beat up.
They look great.
They look great. These are my top picks for the menopausal transition. And when we talk about the menopausal transition, that can really begin unless it's surgical, the late 30s. And it might be a decade long or longer. The average age of complete menopause, which is 12 months without any uterine bleeding, is 51 to 52.
Yeah.
But symptoms can begin over a decade before.
Wow.
So these books talk about the research behind hormonal replacement therapy, the mental components, things to talk to your provider about. Patients can always go to a website called the Menopause Society. and look up in their area who is national certified specialists, and find a practitioner in their area. All of these people's names who are authors of these books, they are interviewed on podcasts if that's how people prefer to learn.
So, okay, so you can either read these books, you can find these specialists via podcast. Hannah, you are amazing. Thank you. Our conversation is not done.
I know, we gotta keep going.
We just hit the tip of the iceberg with this, but we do have to wrap today. Hannah will be back for another episode of Mom Matters. In the meantime, make sure you check out those books, and I certainly hope that we've given you at least a little bit of something to chew on for now.